Talk to me about what it's like on the ground for your aid organization. Is the aid getting in?
Sure, Carolyn, and thank you for covering this important developing story. I can tell you that our teams are telling us that as of this past weekend, we were allowed to have 2 of our aid trucks come in. We could have sent in 2 more. Those were not permitted entry because they were carried what was classified as dual-use items. Many of those items on the truck that were classified as such include solar panels, basic logistical equipment that we need, basic shelter items that we are in need of today. And so while there is some improvement that we're seeing in the supplies that are coming in terms of the medical humanitarian needs, a lot more can be done.
What do you make of the fact that the Israeli government has said we're only going to let half of the number of aid trucks through the Rafah crossing on account of the fact that there is a delay in returning all of the bodies of the deceased hostages?
Couple of things there, and of course a tragedy that needs to be considered on all sides of this genocide in the last 2 years. But really, you know, the right to humanitarian aid is enshrined in international humanitarian law and should have never been a consequence of the war. So it is unfortunate that there continues to be an instrumentalization of aid, and honestly, as if the Palestinian civilians in Gaza have not had enough for the past 2 years. There continues to be, as the IPC has classified, a gut-wrenching famine underway there. And so aid has never truly been enough over the past 2 years. And instead of allowing aid organizations like ours to catch up, what we're seeing, as you've pointed out, is a continued curtailment of that aid. Instead of catching up, we're seeing even more cuts.
Sana, a lot of the images that we're showing our viewers across the country right now show Gaza that has been absolutely flattened. So how do physicians like those who are volunteering with Doctors Without Borders administer health care when facilities like hospitals are now piles of rubble?
It's a sad, dystopian, man-made reality. Indeed, the entire healthcare infrastructure is in ruins, and there is a lot that needs to be done there. So, if we were to go back to what is needed now that the ceasefire is in place, look, several of our cargo shipments today from Egypt and Jordan, they're still being delayed. Our biggest priority right now is to be able to increase the bed capacity, to take those patients off the floor in the hospital, take them out of those alleyways and give them some beds to lie on so that we can provide them treatment. Our priority is getting those 3 to 4 babies that are in ICU sharing a single incubator to get them the treatment they need to have a shot at life. Our priority is to get in the much needed food, the medical supplies. Look, we've been able to navigate the complex environment that has been created for us over the past 2 years, but there's so much that needs to still be refueled, repaired, restructured, rebuilt, and we need a massive scale up to be able to do that. And to be able to do that with who is our existing workforce today. These are doctors for whom home is the humanitarian context themselves. You know, much of our 1,000 plus staff that is operating in Gaza are local Palestinians, locally hired staff, and 100 odd come from around the world, including Canada. So these are people that are living through the real tragedy that we're seeing live streamed on our devices and across TVs. And they're the ones that we're relying on, and they're the ones donating their own blood. They're the ones coming in hungry as they're trying to treat patients. They're the ones with their sweat dripping on operating tables because of a lack of fuel and us unable to operate in those conditions. We're seeing our water treatment, water desalination plants being that had been attacked. We need to get water in, we need to get medical supplies in, we need to rebuild this healthcare infrastructure, and we need to be able to do it now at scale.
Fundamentals that are needed today and major rebuilding that will be needed in the months and years ahead. Sana Bég, Executive Director of Doctors Without Borders, thank you for your time today.
Thank you.